All right, so today, we're going to dive into a world that, you may not think about every day, but
Hmm.
it's something that's had a big impact. I mean, a huge impact on human health and well-being.
Oh, yeah.
And that is dental implantology.
Absolutely.
We're going beyond just the what of implants, or we're really uncovering the why. Why do these things work? How did we even get to this point? What's the science behind these little marvels that can basically give you back your smile, you know?
Yeah, it's fascinating, really, when you think about it. For centuries, people struggled with the consequences of losing teeth, you know,
Hmm.
difficulty eating, speech impediments, and let's be honest, the impact on confidence can be huge. Early attempts at tooth replacement, like, using materials like gold or ivory, they were really more about aesthetics than function. They looked the part, but they didn't really act the part.
So it wasn't just about filling the gap. It was about restoring the ability to, well, like chomp on an apple without worrying about your tooth flying across the room.
Yeah,
Right.
exactly. And that's where the concept of osseointegration comes in. It's really the biological process that's at the heart of modern dental implantology.
Hold on. Osseointegration. That sounds a bit intimidating. Can you break that down for us a little bit?
Sure. Picture this. You plant a seed in the ground, and its roots grow deep, and that anchors it firmly into the soil. Well, osseointegration is similar. It's the process where the bone actually fuses directly to the surface of the implant, creating this really strong and lasting bond.
Okay, so it's not just like wedged in there. It's actually becoming part of the jawbone.
Yes.
But the body's pretty good at rejecting foreign objects from
Yeah.
it. So how does it accept a metal implant?
Yeah, that's a great question. That's where things get even more interesting. It all boils down to biocompatibility. You see, the implant material needs to be something the body won't reject, something it won't react negatively to. And early pioneers, they tried various materials, things like gold, alloys, even plastics. But none of them really achieved that true osseointegration. The turning point came with the discovery of titanium's really unique properties.
Titanium. That's,
Yeah.
what they use in spacecrafts and fighter jets. Seems a bit heavy duty for teeth.
You'd think so, right. But titanium is not only strong and lightweight, it's also remarkably biocompatible. It has this incredible ability to integrate with bone, forming a direct bond. And that's what makes it really the gold standard, or should I say the titanium standard, in modern implantology.
So it's not just sticking a titanium rod in the jaw and calling it a day. There's got to be more to it than that, right? I mean, the body doesn't just say, hey, titanium, welcome home.
Absolutely. Osseointegration is really an amazing biological dance. You see, once the implant is placed, a whole cascade of events starts at the cellular level. Blood clots form, inflammation kicks in. These are all parts of the healing process. Then bone cells migrate to the area, and the jawbone actually starts to remodel itself around the implant, creating that really tight, lasting bond.
Wow, so it's like the body is building a custom fit home for this titanium newcomer.
Yeah.
But I'm guessing this whole process, it requires some serious precision, right?
You're spot on. Meticulous surgical techniques, they're absolutely crucial for successful osseointegration. Creating the perfect environment for healing, that plays a huge role in how well the implant integrates with the bone and how long it lasts. It's really a testament to how far dental science has come, combining the knowledge of biology and engineering in this intricate procedure.
That's amazing. It's mind-blowing to think we've gone from, gold caps to a process that mimics nature at like a microscopic level. But let's talk more about titanium for a sec. What makes it the material of choice for implants? Are there any other, contenders on the horizon?
What's fascinating about titanium is that it really does tick all the boxes. It's strong enough to withstand the forces of, chewing, lightweight, so it doesn't feel bulky in the mouth. And it's resistant to corrosion, which is essential in the moist environment of your mouth. But most importantly, it has that unique biocompatibility. It readily forms a bond with bone.
So titanium's sitting pretty on its throne for now. But I'm sensing there's always a quest for something even better in the world of science, right? What's brewing on the horizon, material-wise?
That's the great thing about science. The quest for innovation never stops. There's a lot of interest in zirconia, which is a type of ceramic. It boasts excellent biocompatibility, and it has aesthetic advantages in certain cases, but, long-term data is still being collected on that. So titanium remains the tried and true champion for now.
Titanium,
Oh,
the champion,
yeah.
but not the only player in the game. And it sounds like it's not as simple as just like grabbing any titanium off the shelf, right? There are specifics even within the world of titanium implants, I'd imagine.
You're catching on quickly. It's not just about the material itself, it's also about how its surface is designed at a microscopic level. Think of it like this. To get a good grip on something, you need the right texture. Well, the same applies to bone integrating with the implant.
Okay, so we're going even deeper now, down to the nano level. We're talking about manipulating the surface of the titanium to encourage the bone to really grab on.
Exactly. We call this surface roughness, and it plays a vital role in how well the bone cells attach, how quickly bone forms around the implant, and ultimately how stable the implant will be in the long run. There's a whole arsenal of surface treatments available. Things like sandblasting, acid etching, even coating with special materials to enhance this process.
So it's like we've zoomed in from a spaceship made of titanium to like a microscopic landscape where we're creating the perfect terrain for bone cells to, build their titanium fortress. It sounds incredibly complex. Yeah. But it's also fascinating to see how science is harnessing these tiny details to make implants even more successful.
It really is remarkable how much we can achieve when we understand and manipulate these tiny details. And that's just the tip of the iceberg. What we've discussed so far is just the foundation. There's a whole other layer of considerations when it comes to ensuring long-term success of an implant. It's not just about the implant itself. It's about the person receiving it, their health, and their lifestyle.
It makes sense, right? Like building a house. You need the right materials, but the foundation, the ongoing maintenance, they all play a role in how well the house stands the test of time.
Mhm.
So let's talk about those factors, the factors that can make or break the success of an implant. What do we need to consider beyond just the implant itself?
That's a great segue into the next part of our deep dive. We'll explore the bigger picture of dental implantology, looking at all the factors that contribute to long-term success. Because as you've rightly pointed out, it's about much more than just the implant itself. It's about the whole person.
So we've talked about titanium being like this superstar, right? The superstar of implant materials. And we talked about surface roughness playing this key role in osseointegration. But let's zoom out a bit now. When we talk about long-term success for dental implants, what else comes into play?
You've hit the nail on the head. A successful implant journey isn't just about the implant itself. You need this holistic approach that takes into account the patient's overall health, lifestyle, and habits. It's like a puzzle, right?
Mhm.
All the pieces need to fit perfectly for that picture to be complete.
Okay, so I'm intrigued. What are some of these puzzle pieces that we got to factor in?
Well, first and foremost, we have to look at the quality and quantity of bone that's available at the implant site. Think of it as the foundation of a house, right? A strong foundation, it's crucial for stability.
So if someone's lost bone, maybe due to injury or like long-term tooth loss, could that be a challenge then?
Exactly. In those cases, we might have to do bone grafting procedures to actually build up that foundation before we can even think about putting an implant in. It's like adding extra support to make sure that that implant has a solid base to, integrate with.
Makes sense. So
Yeah.
it's all about creating the perfect environment for success, right?
Yeah.
So bone quality is one piece of the puzzle then. What else do you look at?
Smoking is a big one. Smoking actually, it impairs blood flow and it impairs healing, which are essential for osseointegration to actually happen.
Yeah.
We advise patients very strongly to quit smoking both before and after the procedure to really give them the best chance of success.
Okay, smoking is a definite no-no. What about other health conditions? Do they come into play at all?
Absolutely. Certain medical conditions, like uncontrolled diabetes, that can affect healing, and that can increase the risk of complications. Even some medications, things like, those that are used for osteoporosis, can interfere with that osseointegration process.
So it's really about this thorough understanding, right? Understanding the patient's overall health profile, not just their dental history.
Precisely. It's like being a detective, gathering clues to make sure all systems are go for a successful implant journey, so to speak. We need to consider all the factors that could potentially influence the outcome.
It's a good reminder, too, that oral health is it's so connected to overall health. It's not just about a pretty smile. It's about the well-being of the whole person.
Right. Couldn't have said it better myself. And, let's not forget about the patient's commitment to maintaining good oral hygiene after the implant is placed. Just like natural teeth, implants, you need to brush them, you need to floss, they need to be regularly checked by a
It's
dentist.
like a team effort, right? The dentist does their part. And then the patient needs to step up as well. It's this partnership for long-term success.
Exactly. And that's why that initial consultation is so crucial. It's not just about examining the mouth. It's about getting to know the person, understanding their concerns, their expectations, their lifestyle. It's about building a relationship, one that's based on trust and open communication.
It sounds like a very personalized approach,
Yeah.
which makes sense.
Yeah.
After all, everyone's mouth is different. Everyone's health journey is unique.
Absolutely. It's like tailoring a suit. It needs to fit perfectly. And that's why we develop these personalized treatment plans for each patient, taking all these factors that we've been talking about into account.
So let's walk through that journey a little bit. For a patient who decides to, I want to get a dental implant,
Yeah.
what can they expect? What's the typical process like?
Well, after that initial consultation and assessment that we've already talked about,
Yeah.
the next step is often 3D imaging. We use these really advanced technologies like cone beam computed tomography, which is also called a CBCT, and that creates a detailed 3D image of the jawbone.
Ah, so it's like getting a blueprint of the construction site before you start building.
Precisely. This 3D image gives us this precise view of the bone structure,
Yeah.
and it allows us to plan that implant placement with, pinpoint accuracy. We can determine the optimal implant size, its position, the angulation. All of these things are crucial for long-term stability and function.
So it's almost like using GPS,
Right.
navigating that implant to its perfect destination in the jawbone.
That's a great analogy. And, with this detailed roadmap, we can often place the implant using these minimally invasive techniques, which leads to faster healing and, less discomfort for the patient.
It sounds like a far cry from the old days of hammering in a gold tooth. So once that planning is done and the implant's placed, what's next?
The next stage is really all about healing and osseointegration. We usually allow for, a period of several months for the bone to really fuse securely to that implant surface. And during this time, we give the patient really detailed instructions on how to care for that implant site and ensure, proper healing.
So it's kind of like tending to a delicate sapling, right? You give it time to take root and grow strong.
Exactly. And then once osseointegration is complete, then we move on to what we call the restorative phase. And that's where we attach an abutment to the implant.
Okay, now I'm going to need a little bit of, explain it like I'm 5 here. What exactly as abutment and what's its role in all this?
Think of the abutment as like a connector piece. It acts like a bridge between the implant, which is, embedded in the bone, and the artificial tooth or the crown that will eventually be attached on top.
So the implant's like the root of the tooth. The abutment is like the neck. And then the crown is like the visible part that we all know and love.
Perfect analogy. And just like a natural tooth, the crown, it's custom made to match, the shape, the color, the size of your existing teeth. It creates a really, really seamless and natural looking smile.
Wow, it's amazing to think about all the steps involved in all this.
Yeah.
The planning, the placement, the healing, and then the restoration. It's a real testament to the artistry and precision of modern dentistry.
It really is. And, the best part, with proper care and maintenance, a dental implant, it can last a lifetime. You're restoring not just your smile, but your ability to eat, to speak, to live life to the fullest.
That's pretty incredible. But I have to ask, are there ever any bumps in the road? What are some potential challenges, maybe complications that could arise along the way? So we've covered like a lot of ground. We went from, the history of implants to this whole intricate world of osseointegration and even got a glimpse into the future, smart implants, maybe even like tooth regeneration. But I imagine, as with any medical procedure, there are potential risks, right? Complications involved with dental implants. So what are like the things that could go wrong and how are those challenges addressed?
You're absolutely right. While dental implants have a really high success rate, I mean, we're talking upwards of 95% in a lot of cases. It's important to remember that no surgical procedure is completely risk-free.
That makes sense.
Yeah.
So what are some of the potential complications that patients should be aware of?
Well, like any surgery, there's always a risk of infection. We take a lot of precautions, meticulous precautions to keep everything sterile during the procedure. And we prescribe antibiotics to help prevent infection after the surgery.
So it's all about minimizing that risk as much as possible. What other challenges can come up?
Sometimes there can be damage to surrounding tissues, like nerves or
Right.
blood vessels. That's why the precise planning, that 3D imaging we talked about, it's so crucial. It really lets us map out the safest way to place the implant and make sure we avoid those really vital structures.
Like having a detailed roadmap,
Yeah.
right? To navigate those delicate areas.
Yeah.
But even with the best planning, I mean, things can still happen sometimes, right?
That's true. Unfortunately, in some rare cases, the implant might not integrate properly with the bone. And we call that implant failure. And that can happen for different reasons. Things like poor bone quality, smoking, even sometimes an undetected infection.
So it's about really being aware of those risk factors up front
Yeah.
and then addressing them, proactively. But what happens if an implant does fail? Is that it? Is that the end of the road?
Not always. In a lot of cases, what we can do is we can remove that failed implant, let the site heal, and then we can try to place a new implant. Sometimes we might need to use, some additional techniques like bone grafting to give us a better chance of success the second time around.
So it's all about finding like the right solution for each individual case. Even when we're faced with these unexpected challenges, I guess it really emphasizes how dental implantology is so dynamic, right?
Yeah.
It's constantly adapting and evolving to meet the needs of the patients.
Absolutely. And speaking of evolution, one of the most exciting points of this field is the innovation that's constantly happening. We're always trying to improve outcomes, make the process more efficient, and develop new technologies that can help us address even those really complex cases.
Okay, you've got my attention now. What are some of these cutting edge advancements? What are you excited about for the future of implantology?
Well, one area that's particularly fascinating is the development of what we call smart implants. Imagine an implant that has like built-in sensors that
Yeah.
can monitor things like pressure, temperature, even the health of the surrounding bone.
Wait, hold on a sec. Smart implants? Are we talking about like implants with their own little tiny computers inside them?
That's basically it. Yeah, these sensors collect data, real-time data,
Yeah.
and that data can be sent wirelessly to your dentist, and that can give them really valuable insight into how the implant is actually functioning and how the bone is healing.
So it's like having a tiny little health monitor
Right.
right in your mouth, constantly checking in, reporting back. But how did that help the patient?
Well, imagine if we could detect, potential problems really early on, before they even become serious. Like if the sensor picks up signs of inflammation or bone loss, we can step in early, and that could potentially prevent the implant from failing.
Wow, that's amazing. Like an early warning system, right?
Right.
To protect your investment,
Yeah.
so to speak. What other innovations are we seeing on the horizon for implants?
Another area that's really moving forward quickly is 3D printing. We can actually create these custom designed implants that perfectly match the patient's anatomy, even in cases where the bone structure is really complex.
So no more one size fits all. It's all about those personalized solutions, tailored to each person's needs.
Exactly. And as 3D printing keeps getting better and better, we'll be able to incorporate even more sophisticated features into the implants. Things like bioactive coatings that can actually stimulate bone growth, or antimicrobial properties to help fight off infections.
It's mind-boggling, all these possibilities. It feels like we're right on the edge of like a whole new era for dental implantology,
Hmm.
where technology and biology are coming together to create these really personalized solutions for patients.
I couldn't agree more. And don't forget the research that's going on into those even more futuristic ideas. Things like tooth regeneration,
Uh,
using stem cell therapies. That's still early stages, but it has incredible potential for the future of dentistry.
it's like something straight out of a sci-fi movie, right? Regrowing your own teeth.
Yeah.
But I have a feeling what seems like sci-fi now could be reality a lot sooner than we think, given how quickly this field is innovating.
I'm optimistic about that too. And it's that spirit, right? That spirit of discovery and that, constant push to find better solutions. That's what makes this field so exciting to be a part of.
This has been so eye-opening, this whole deep dive. We went from, those early rudimentary beginnings of tooth replacement to the complex world of osseointegration. And now we're talking about smart implants
Yeah.
and even tooth regeneration. It's amazing.
Well, it's been a pleasure sharing these insights with you and with our listeners. I hope this deep dive has given everyone a sense of curiosity and an appreciation for the amazing advancements that are happening in the world of dental implantology.
It really has. And it's a great reminder that even something as seemingly simple as replacing a tooth
Hmm.
can be this amazing blend of science and technology and artistry. So
Yeah.
for anyone listening out there, if you're thinking about dental implants
Mm.
or just curious about this field, learn more, ask questions,
Yeah.
embrace those possibilities that this field, always evolving, has to offer.
Well said.
Yeah.
And ultimately, it's about restoring more than just teeth. It's about confidence, function, quality of life, and that's something worth smiling about.
Couldn't agree more. This has been an amazing journey into the world of dental implants. So as always, folks, keep those minds curious, keep exploring, And we'll catch you on the next deep dive into another fascinating topic that'll make you think and learn and maybe
Yeah.
even smile a little brighter.